So a typical day as a flight nurse, usually come in the morning or at a night shift. Beginning of the shift, we'll do a shift brief, basically covering issues such as weather, safety issues, any maintenance with the aircraft, and anything that's come up in the past couple of days that we need to talk about. From there, that involves the neonate team, the PEDS team, and pilots and the rest of the crew that may be around. From there, we usually go and do our aircraft checks. Usually we carry 90 different medications, gotta make sure none of them are expired, make sure all our equipment is charged, make sure everything in the aircraft is in its place, so we are ready to go at a moment's notice with a flight. And then from doing aircraft checks, we always do follow-up on all the patients we've transported over the last couple days. What we'll do is we'll do a follow-up if there's any educational issues that we can come up with other crew members that come out of flights, anything we can learn from that. We also write back a letter to the referring doctor telling them of the care that the patient has received at Mayo. From there, we just basically are involved with a lot of research here. We're doing some sepsis research, some landing zone research. We work closely with basic EMTs around the areas, the ambulance services, and then just are ready to go at a moment's notice for any type of flight and be ready for any type of flight. The reason I chose flight nurse as a career is that when I was back in nursing school, I obtained my EMT certification, and I ended up volunteering for my hometown ambulance. And with that interaction with emergency medicine, doing ambulance calls, medical trauma, pediatrics, I just knew my nursing career path would take me towards emergency nursing. During nursing school, I was working part-time at Mayo at environmental services, and during that time I was able to take advantage of the tuition reimbursement and actually went through nursing school, got my nursing degree, got hired as a nurse here at Mayo and worked on the general medical floor for 2 years. After 2 years, I gained that experience, then I went on to work in a trauma surgical ICU for about 5 years. Gained a wealth of knowledge on that floor, and then went on and worked in the emergency room for about 3 years. From there, a flight nurse position came open. I applied for it and was accepted. My recommendations for people who are choosing flight nursing as a career would be to obtain those extra certifications, get all the experience you can. Extra certifications I mean by pediatric life support, adult life support, get ICU experience in a larger hospital setting where you get the variety. Also, maybe an EMT certification, get such things as transport experience if you can. One of the best things about flight nursing is just the variety of patient care that you get to provide. There are times where we do fixed-wing flights across the country or taking care of critical patients, and there are times that we are doing interstate crash scene flights and taking care of trauma patients. And I think one of the best things of flight nursing and nursing at Mayo is that you get to work with a team, a crew that strive for excellence in patient care.